Good afternoon, ladies and gentlemen, and thank you for the opportunity to discuss the stepwise approach towards rabies elimination and the role that it plays towards creating customized rabies elimination work plans. As discussed during previous presentations, the Global Strategic Plan relies on a country-centric multi-stakeholder collaboration, and as such, countries need to lead their own rabies elimination efforts. This country-centric concept, however, is not unique. For example, a sustainable, government-driven approach was vital for the eradication of smallpox and rinderpest and also played a role in the drastic reduction of polio and several non-communicable diseases. And these lessons still apply today when we consider the global COVID-19 pandemic. Countries are working towards controlling the disease within their own borders with the help of the global community. And once the disease has been controlled internally, will support most likely be offered to those countries that are lagging behind. In recognition of the fact that governments have to lead their own rabies elimination efforts, many have started to develop their own national strategic plans. As mentioned by Dr. Torres in the previous presentation, these strategic plans are important political documents that are vital for governance and advocacy purposes. And despite being written differently, these documents often all list a common approach towards rabies elimination and most oftentimes lack the granular details. If we consider the fact that the approach is almost always the same, the detail as to how the strategic plan will be implemented is what is truly important. These details are often highlighted, not in the strategic plan, but in an accompanying work plan. In our experience, the SARE plays a vital role in the creation of rabies-specific work plans, and I'll focus the rest of my talk on how this is achieved. The SARE is an Excel-based M&E framework that consists of two components. An assessment component that identifies activities that need to be addressed in order to progress rabies elimination efforts, and a work plan component that enables a country to develop a comprehensive rabies work plan based on those pending activities. The SARE assessment component highlights activities that have been completed and those that still need to be done in order to progress rabies elimination. To this end, the completion of the SARE assessment relies on the participation of representatives from various ministries, as the assessment focuses on numerous categories that play a role in the elimination of rabies. While all of these categories play an important role, one category specifically, cross-cutting issues, focuses only on the One Health concept and its implementation towards rabies elimination. As a first output, the SARE assessment highlights strengths and weaknesses across the different categories. This shows in which categories a national government is strong and in which categories more effort is required. The SARE tool also provides an overall SARE score that places a country on the SARE scale, illustrating the progress towards rabies elimination. The second output, the SARE score, allows countries to monitor their progress towards freedom from dog and human rabies. The SARE score is an important metric, not in terms of comparison between different regions or countries, but in terms of showcasing progress within a country. Considering the importance of the SARE score and its role in measuring progress within a country, let's briefly look at a few examples of where the SARE assessment has been used in the real world. Since its development in 2015, 23 countries have undertaken more than one SARE assessment, and 12 of those countries have demonstrated an increase in their SARE score. Not shown on the graph are some of the countries who had a SARE score that had either remained unchanged or had regressed between SARE assessments. Unchanged SARE scores are not an uncommon occurrence and quite often indicate a government who simply needs to ensure additional efforts are allocated towards rabies control and elimination. Similarly, in the few cases where the SARE score had regressed, Red flags were raised and the government had taken an appropriate course of action to remedy any shortcomings. Another element to notice on the graph is that a lot of countries showed an incremental increase in their SARE scores between assessments. These increases most often correlated with when the work plan component was developed and integrated into the SARE. As such, it warrants to have a closer look at this work plan component and the role that it plays. The second component of the SARE is the work plan component, where the SARE assessment component highlighted all of the pending activities that need to be addressed. The work plan component provides an overview of how to achieve these pending activities. Let's take a brief look at the process and the expected outcomes. As a first step towards generating a work plan, the SARE framework lists all of the pending activities. Once listed, the SARE automatically generates a draft work plan for every activity, and each activity gets suggested contents that accompanies it. The content is broken down into different headings. Briefly, steps that need to be taken to complete the pending activity, expected outcomes, responsible authorities, time frame, and key performance indicators. Because the draft contents is simply a recommendation, workshop participants get the opportunity to manually edit the content of the work plan and in so doing, customize it to fit their own need. Once ready, the Excel-based work plan is exported as a PDF document. By generating a work plan of suggested contents, time is saved because participants do not have to draft and compile their own work plan from scratch, but instead spend time on customizing the contents to fit their own need. This not only speeds up the process, but also ensures that the work plan is ready for implementation much sooner. The SARE assessment and work plan development is most often done during in-country workshops that have participants from various stakeholders and ministries. These workshops typically last 5 days, and at the end of which the following deliverables are produced. Firstly, a rabies elimination work plan is developed and ready for implementation. As the work plan has time frames allocated to each activity, the SARE automatically generates Gantt charts that allows the users to track progress. If the global dog rabies elimination pathway tool is used, a cost estimate for the elimination of dog-mediated rabies by means of dog vaccination can also be included. Most importantly, within a week, a government has the finer details that are required to support the content of the National Strategic Plan. For example, if the strategic plan's objective was to vaccinate 70% of the dog population, the work plan provides a phased approach towards reaching this objective while also supplying timeframes, responsible authorities, and KPIs for each of those steps. The use of the SARE tool, however, is not just theoretical but practical, and to date the SARE has been used in more than 96 countries around the world, with 26 in-country SARE assessments done to date. Not only were these SARE assessments undertaken, but many countries have gone on to develop strategic plans, with the work plan laying the foundation for the future work. On the map, red stars represent countries that have finalized their national strategies, and black stars represent countries that are completing the development of their national strategies. In conclusion, by using the SARE, the implementation of national strategies can be evaluated on an equal footing. Donors and stakeholders can determine how they best may contribute towards the global efforts of dog rabies elimination, and countries can progress their own rabies control efforts in a logical manner. Thank you for the opportunity to provide this brief overview of the SARE and the role that it plays in the development of customized rabies work plans at this important webinar.